Today, in our society, many people try to fit into today's world by being so-called thin to be accepted by their peers. Eating disorders are more than just a struggle with food. It also takes a toll on our emotional, physical, and mental state of health. Anorexia. This disorder affects all ages and both genders. In the article Journal of Psychology, Levine states, anorexia nervosa is defined by severely low weight, intense fear of gaining weight, disturbed perception of body shape and weight, and amenorrhea. It is a serious psychiatric condition with medical consequences. It starts in adolescence and continues into adulthood and can be dangerous and even fatal if not treated. The warning signs and symptoms are dramatic weight loss in these individuals. They show signs of not feeling hungry and refusing to eat food. They suffer from shame and low self-esteem. They also feel the need to be in control of their weight. According to the article by Dr. McCollum, she states there are several medical complications for anorexia. They include irregular heartbeat, low blood sugar, loss of bone mass, kidney and liver damage, osteoporosis, insomnia, anemia, infertility, depression, electrolyte imbalance, cathartic colon from laxative abuse, low potassium, and the most common cause of nocturnal cardiac arrest, death. Treatment is first to restore the body back into its natural state of health. Psychotherapy is needed, along with prescription medications to help these individuals with their anxiety and depression. Next is the growing concern with bulimia. Bulimia is another serious eating disorder. In the article, Bulimia nervosa, causes, symptoms, signs, and treatment help. Bulimia nervosa is a psychological and life-threatening eating disorder by the ingestion of abnormally large amounts of foods in short time period, followed by the attempt to avoid weight gain by purging in what was consumed. The episodes are rapid and frequent. They are often triggered when a person fails to achieve a goal, such as a diet. The warning signs and symptoms are vomiting after eating large meals, abuse of laxatives, and excessive exercise. Health consequences to bulimia are tooth decay. This is because the stomach contains harmful materials that can harm the teeth. Another is dehydration because of vomiting. This can eventually cause a person to lose consciousness. It also can damage the kidneys. Also is addiction to laxatives, which causes stress on the stomach and intestines. Treatment includes counseling from a psychotherapist, medications, and help from a nutritionist. Lastly is the eating disorder people might not think of as one. This is the binge eating disorder. The binge eating disorder. This is where one eats large amounts of foods and feels powerless to stop. Warning signs and symptoms are eating foods in large amounts, hoarding food, and even eating when full. It also has emotional effects, which are depression, shame, and anxiety. According to the article Health Consequences of Eating Disorders by Jane Framingham, she states, binge eating disorders often result in many of the same health risks associated with clinical obesity. Some of the potential health consequences of binge eating disorders include high blood pressure, high cholesterol levels, heart disease as a result of elevated triglyceride levels, secondary diabetes, and gallbladder disease. The treatment to binge eating disorder is to seek medical help for this disorder and to talk to a specialist. As previously discussed with the eating disorders that people in our society face, it is important that we recognize the struggles these people face every day with their battles with food. It is important to know that what can happen to our bodies if we do not care for them. If you know a loved one that is suffering from any of these eating disorders, please seek medical help.